Hi, I'm Dr. Kiros, an MD PhD candidate out of Albert Einstein College of Medicine, co-founder and CEO of Bow Therapeutics, an antibody discovery company. I'm here to tell you about a treatment that I've been working on for an emerging threat called chikungunya virus. Chikungunya virus is an arbovirus that is transmitted by the same mosquito that carries both Zika and dengue virus. It clinically manifests itself with headache, fever, macular papular rash, muscle pain, and most notably joint pain, which can be so debilitating it leaves patients bedridden for weeks, and a large subset of these patients go on to develop a chronic arthritis that can last years after the initial infection has passed. Newborns are also increased risk for more serious complications that include encephalitis, seizures, and cardiovascular complications that can progress to death. There is no cure or vaccine for chikungunya virus. Citing these past few months, the cost of a pandemic has on all aspects of life. Shown here is chikungunya, originated in 1952 on Tanzania, off the island of Madagascar into the Indian Ocean region, where over 1 million cases have been reported. It continues its spread throughout the years through parts of China, Australia, and even into Europe. A single mutation led to a major outbreak in the Americas with 2.5 million suspected cases, including 1 locally acquired in Texas, 12 locally acquired in Florida, and 453 in Puerto Rico. To get an idea how close this virus is to causing an outbreak in the United States, shown here is a vector map that is the mosquito that can transmit the virus in habitat. In dark blue is where the mosquito has been reported, and in lighter blue is the potential where the mosquito can also habitat. With intensifying climate change, we also see the intensification of viral threats of these viral infections. Because the mosquito favors temperate climates, it will increase its viral infection, and with global travel to these endemic regions, will also add to the increased risk of a chikungunya pandemic. To get an idea how large of an economic burden an outbreak to the United States alone could be, the spread of chikungunya virus off a data-driven study out of Yale estimated a societal cost of $185 billion and a burden of 23.8 million disability-adjusted life years. This is 46 times greater than a dengue outbreak and 115 times the number of disability-adjusted life years. This large potential market has attracted the development of therapeutics with over a $600 million addressable market based off the projections of a Pan American Health Organization data set. Competitors include Paxvax and Moderna, which are in early clinical trials, however are using unproven approaches, whereas Bow Therapeutics is using human antibodies, which has been a proven treatment for other viral infections such as ZMapp and palivizumab for RSV infection. The dual threat of an antibody is it can be used for both prophylaxis and for active infection. So first responders that can receive an antibody for active infection, and travelers may receive an antibody for prophylaxis. Shown here is our proof of concept. So under biosafety level 3 conditions, we use the authentic virus in a mouse study. So first we give the antibody prophylactically, and then a lethal dose of the authentic virus, and follow for a 21-day challenge. So all the mice that start out alive with 100% survival. Shown here in dashed line is an inert antibody, and we see all the mice die within less than a week. Shown here in the red line is the best-in-class murine-derived antibody, which did not do much better than the negative control. And shown in the blue line is our lead candidate, which showed a durable protection for the 21-day challenge. Now, for active infection, we did another study where in this case we gave a lethal dose of the virus initially and then a therapeutic dose of the antibody. So again, all the mice started out alive, and we see the dashed line, all the mice died within less than a week. The best-in-class murine in red did a little bit better. However, our fully human lead candidate showed complete protection with 100% survival. Where Bow Therapeutics is in our product development plan, all the antibody discovery has been completed. We are now moving next to our next milestone for non-human primate studies, and we are seeking $1.14 million for facilities and personnel, in vivo optimization, map production, and non-human primates. Once we now have this proof of concept, we will then file for our IND application and move forward to clinical trials and ultimately seek FDA approval. In summary, Bow Therapeutics offers patent-protected therapeutic antibodies with durable protection in 2 mouse studies for prophylaxis and for active infection. Bow Therapeutics is seeking $1.14 million to conduct non-human primate studies, establishing toxicology and pharmacokinetics, and establishing clinical indications for both prophylaxis and active infections. We hope you join and invest in Bow Therapeutics in preventing the next pandemic. Thank you.